let's officially kick off our Maxicare Wellness Fridays. All right, welcome to Maxi Life Wellness Fridays featuring COVID-19 vaccines, benefits, and side effects. I'm Patricia Ramirez. He's not your host for this event. This topic, as we all know, is very timely, especially because, just like what I told you earlier, today is National Allergy Day, as declared in the Presidential Proclamation number 1313 last July 8, 2007 by former President Gloria Macapagal Arroyo. It is an annual event held to increase the awareness and educate Filipinos on the growing problems of allergies amongst adults and children. Since the COVID-19 vaccines were introduced and started rolling out, many of us are really curious and would like to know more about the effects after the vaccination. With the experts, we will tackle the most common concerns and other key information that you will need to know in this session. So I'd like to introduce to you formally our speaker. Our speaker specializes in pediatric and adult allergy, asthma, and immunology. She is currently practicing in the section of allergy and immunology, Department of Pediatrics at the UPPGH. She is also an immediate president and board member of the Philippine Society of Allergy, Asthma, and Immunology. So let us welcome Dr. Marisha Stella T. Recto. Hi, Dr. Recto. Good afternoon.
Hello, good afternoon to all our viewers. It's indeed an honor and a pleasure to be invited to these sessions and also to help many of you out there make your decision about whether or not to get the COVID-19 vaccine. Okay, so I've seen the polls and I see that there's almost an equal number of our attendees who choose, well, I'm not sure if it's either by choice or by circumstance that they have received the vaccines or haven't received the vaccines. But hopefully, we can help you make your decision with this lecture. So it will be about vaccines, especially allergies, and should we take the shot? So, the latest COVID numbers as of July 7, 2021 by the World Health Organization shows that almost 185,000 people around the world have had COVID-19 and almost 3 or 4 million have died from this condition. Yet, there are almost 3 billion vaccine doses that have been administered globally. So these are the objectives of my talk. First is to discuss the immune response to COVID-19 infections. Second is how to see how the different COVID-19 vaccines work. And the third is to discuss the different reactions to COVID-19 vaccines and how we can approach their management. So before we go into the vaccines, we have to first understand how COVID-19 infects us and how it can affect our immune system. So the COVID-19 is what we call an RNA virus. RNA is the genetic template of any organism. And for the virus, the SARS-CoV-2 virus, it is RNA. And you see the typical configuration that it looks like a globe with spikes around it. And these spikes are the ones that attach now to different receptors that are found on our epithelial cells, especially the respiratory epithelia that are found in the nasal tract or in the lungs or even gastrointestinal tract. After attachment, then the cell will engulf now the virus, and within the cell, you would actually have release of this RNA or the genetic template, which will allow now the virus to replicate within the cell by using the cell's own machinery. And while they are replicating, there is going to be a very profound immune reaction or inflammation called pyroptosis that can cause damage to the cell. Now, after making another replica of itself, the virus now is released after causing basically some cell damage. And that is how the COVID 19 infection occurs. Now, what happens after the infection? There are two scenarios that can occur. In 20% of patients who've had COVID 19, we see that there would be a dysfunctional immune response, meaning a very heightened immune response that may cause damage to the lungs, to the gastrointestinal tract, and other organs. And this is what we call the cytokine storm. This will lead to a lot of what we call mortality or morbidity, and basically will lead to severe COVID 19 infection. But 80% of patients will actually recover to COVID 19 infections just like a common cold. And how does this occur? Because our immune system is equipped to actually combat these viruses. We have cells that can engulf these viruses and kill them internally. We also have antibodies that are being produced by other cells called lymphocytes that will neutralize this SARS-CoV-2 so it cannot attach to the respiratory epithelia. And there are also what we call T cells that are important to produce factors that will help to neutralize the virus. So this concerted reaction will lead to a healthy immune response wherein the infected cells are rapidly cleared and regenerated, the viruses inactivated, and there would be basically minimal inflammation or damage to organ systems. So when we have immune reactions against the viruses, we have several players. We have what we call the first line of defense, innate immunity. And we also have adaptive immunity that will entail antibodies and what we call direct cell killing by certain cells called the T cells. So that's why immunity against viruses can actually eradicate a present infection, or they can protect against infection in the future, because these immune cells have memory that upon encountering the virus again in the future, then they can actually combat the virus. So how now do vaccines work? Vaccines are actually a tiny, weakened, non-dangerous fragment of the organism and includes parts of the antigen. So it is enough your body can learn to build a specific antibody. Therefore, if the body encounters the real antigen later as part of the real organism, it already knows how to defeat it. So for SARS-CoV-2, much of the vaccines are developed against the spike protein, those red dots that are on the surface of the virus, and thus we will generate antibodies to those spike proteins, and you would have hopefully immune memory and be able to face a COVID infection without any problems. So now let us go into our overview of the different types of vaccines that we have for COVID-19. So this slide just summarizes the four general categories or platforms of COVID-19 vaccines. The first are what we call the viral vectors, which use a harmless virus that will deliver the genetic code of the COVID-19 into the cell. And this genetic code will encode for the spike protein. The second are the RNA viruses or RNA vaccines that contain the RNA already. And this RNA, again, the genetic template is directed towards the spike protein. So these codes will actually tell your immune cells to trigger immune responses, especially antibody responses against the spike protein. But the other two vaccines are a little bit different. We have the whole virus vaccine that contains actually a whole virus that's either weakened or inactivated, or a subunit of the virus, no? Not always the spike protein, but it could be the spike protein, and basically will trigger an immune response that is not only geared against the spike protein, but possibly against the other parts of the virus. So, just briefly, we will talk about the mRNA vaccines. No? These are the genetic vaccines that contain the genetic template of the SARS-CoV-2, specifically against the spike protein. And it uses our cells, just as I mentioned earlier, to generate the spike protein. So as the spike protein is generated within the cell, this genetic material are not incorporated into our own genetic material. So we should not be scared about that. It is just uh, the spike protein generated, and the spike proteins are now presented outside to our immune system, and then you would have immune responses. Now, these type of vaccines are actually also known as the mRNA vaccines. They are low cost and fast to develop. That's why they were the first to be um, uh, released into the market, and they need to be stored at very low temperatures. So the examples are Pfizer and Moderna. And just to let everyone know that all of these vaccines are actually still under clinical trial until next year. Now, the second type of vaccines are actually what we call the viral vector vaccine. And these need another carrier virus that is basically a harmless virus that contains the genetic material. And when this virus is injected into our system, it also enters our cells and allows the genetic material to be released. So it is also quite an immunogenic type of vaccine. And it has been used already before for Ebola infections. And the example of this are the AstraZeneca, the J&J vaccines, and the Gamaleya or Sputnik vaccines. Now, the third type of SARS-CoV-2 vaccine are the protein vaccines. So this contains little bits of proteins coming from the virus, which are injected into our system and are recognized by our immune system to trigger a response. These type of vaccines have been here before. They have a very good previous safety record, and an example of this is the hepatitis B vaccines. Okay, so example is the Novavax vaccine, which we will be getting soon. Now, the next two types of vaccines are basically whole virus vaccines. The first are the inactivated vaccines that contain a killed SARS-CoV-2 virus as a whole. And the virus that is killed, of course, will not cause illness, but it will enter our system and trigger an immune response. So, an example of these inactivated vaccines are the good old flu vaccines. And these are what we see, this kind of platform is what we see with Sinovac and Sinopharm vaccination. Now, the last type of whole virus vaccine are the attenuated vaccines. These are not killed, but just weakened. And this weakened virus actually simulates a natural infection so that it is possible that the immune response is quite good. But examples of this type of vaccine are the oral polio, which you're all familiar with, and in clinical trials is Codagenics, which is not yet available in any part of the world. So, which are the ones that really work well and which do not work well? Well, before we go into that, we have to consider what we mean by vaccine efficacy. You've heard a lot of that, and to compare it with vaccine effectiveness. Now, when you hear about vaccine efficacy, it's how well the vaccine works. It's the percent reduction in disease incidence in a vaccinated group compared to the unvaccinated group under optimal conditions. And what do we mean by optimal conditions? This is in the context of a clinical trial. So most of these trials are used on healthy patients without COVID-19. So it's the ideal scenario. Now, vaccine effectiveness, on the other hand, is the ability of the vaccine to prevent outcomes of interest in the real world. So this is more realistic. And sometimes it is not identical to the values that we see in vaccine efficacy. So in this table, I've actually tabulated different vaccine efficacy rates available for COVID-19 vaccines. You could see here that the efficacy rate versus severe disease, which is what we really want to happen, that people do not get hospitalized or they do not die from COVID-19, is pretty good, okay, among all the different vaccines, no? And the overall efficacy rate in the sense that it will not allow for COVID-19 infections to manifest, but it does not cover for asymptomatic infections, shows a variety. So you would see what tops the list is Pfizer and Moderna, the mRNA vaccines. However, you could see that the rates of the viral vector vaccines for Astra and Janssen are around 66 or 67%. But Gamaleya or Sputnik, which is basically also a viral vector vaccine, is quite higher because it uses two different kinds of viral vectors and thus prevents what we call immunity to the vaccine. Now, Sinovac has been having mixed reactions. There are some patients who would say, oh, it's not good enough because the WHO only gave a 50% chance that it is efficacious. But that is not accurate. That is only based on one study done in Brazil on healthcare workers that showed that this group only had 50% protection against COVID-19 with this type of vaccine. But other studies done in Indonesia, Turkey, and Chile show much higher vaccine efficacy rates. So it just points that it depends upon the situation where the trial was done. So these are all clinical trial data and also the kind of population and the kind of variants that may have been present. So, the vaccine efficacy, we should not really look at the numbers of this because these are not reflective of the real world scenario. What we have to try to look into is looking into the protection against severe disease, which I believe is the best effect of vaccination. So to be able to induce what we call herd immunity, we should actually go for the vaccines. And depending upon what you will receive, I think you should not be so scared about what you have and what you do not have. So now we will go into the adverse events. So when we talk about adverse events, this is a medical term that means basically side effects, no? So they can range from local to systemic reactions to allergic reactions and some because of the disease itself. So, as of the latest statistics on our COVID-19 vaccines adverse reactions in the Philippines, as reported by the Adverse Events Following Vaccines Committee, we see that patients, around 5 million, have already received their first dose. 1.8 Filipinos have completed their dose. And there are around 42 or 43,000 reported aggregate adverse reactions. Now here, at this time, there was only the CoronaVac or the Sinovac, the AstraZeneca, the Sputnik, and the Pfizer vaccines that were being given at this time. And look at the total number of reports. AstraZeneca seems to have the most reported adverse events. Sinovac, despite its being the most used, did not have as much, but was still quite a lot of adverse events reported. So, what were the top reported events for CoronaVac rather or Sinovac? Most of them were increase of blood pressure, and the rest are what we call reactogenic reactions, which I'll discuss later. For the AstraZeneca and the Sputnik vaccines, the viral vectors vaccines actually had also a lot of reactogenic reactions. No, for Sputnik they had a little bit more of blood pressure increase. Now for Pfizer, it was a blood pressure increase, which is not sure if it is vaccine generated really or because of anxiety by the vaccinee. But we see most of them are what we call um, reactogenic reactions. So, what were the clinical outcomes to these different adverse events following vaccinations to our COVID-19 vaccines? We see that majority of patients have recovered and resolved from them, and very few have actually the rate of having a fatal reaction was even less than one. So far, the FDA has not seen any vaccine that may have caused death. So the reported reactions for allergy, we are all afraid of getting a reaction after a vaccine, especially the COVID-19. But these adverse reactions can actually happen to any vaccine for that matter. So for COVID-19, it is very rare to develop an allergic reaction. And usually it would occur in people with a history of severe vaccine reactions in the past and would occur within the first 15 to 30 minutes. That's why we have to ask every vaccinee to wait for that period of time to anticipate a reaction. And there's a significant portion that actually had hypertension. There is a condition called immunization stress related responses, or ISRR, as reported by WHO. And these are anxiety based reactions that are not connected to the vaccine. So we're not sure. Maybe this hypertension was really more because of that. Some are scared of thromboembolic events, especially with the viral vector vaccines like Astra, and so far there have none been reported in the Philippines. There are some confirmed COVID-19 infections that have been reported after full vaccination, but it's very rare. And the deaths that have been reported have been noted to not be attributable to the vaccine. So because of all these concerns, our society, the Philippine Society of Allergy, Asthma, and Immunology, have come up with some position statements to help our general public as well as the doctors regarding the concerns about allergies and these vaccinations. So the first statement is adverse reactions to vaccines may occur and can range from reactogenic to allergic reaction. And this reactogenic reaction is not the same as an allergic reaction. Patients who have reactogenic reactions are managed with supportive care. And if there are mild allergic reactions, we just give antihistamines. But the severe allergic reaction called anaphylaxis must be managed promptly with epinephrine. And this may happen within the first 30 minutes. That's why patients have to wait and be observed. And the only current contraindication, I want to repeat this because this might be asked again in the Q&A. The only current contraindication to COVID-19 vaccination is a severe immediate allergic reaction like anaphylaxis to a previous dose of COVID-19 vaccine or any of its components. Okay, so what do we mean by reactogenic reactions? These are either local or systemic reactions that are gone by itself in 1 to 3 days. They are managed with paracetamol, pain relievers, hydration, or cold compresses. So why do we get these reactogenic reactions? Remember, we are injecting an immunogen. This is a product of the virus that will induce an immune reaction, and it should induce that reaction locally. So in the area of injection, you would have production of inflammatory mediators or factors that will induce immune reactions that can spread throughout the body. Now, in some patients, the reactions are very heightened, that this inflammatory response will go through the blood vessels and will go to different parts of the body. That's why some are prone to developing headaches, fever, fatigue and chills. So not everybody will have these generalized symptoms. There are many factors that may influence the development of what we call reactogenic reactions. It could be factors that are innate to the vaccine, or there are factors that are due to the way it was administered, or due to intrinsic factors that will affect or that are present in the patient itself. So these three factors interact to determine the individual's experience during and after vaccination. So, what on the other hand is allergy? Allergies are an exaggerated immune response to a harmless substance, and they may involve various mechanisms and may present in different ways. Now, severe allergic reactions are really quite rare, but they exist. And any vaccine, for that matter, can be a potential allergic trigger. So, mild reactions that occur because of vaccination, like rashes, itchy skin, runny nose, sneezing, can be managed with antihistamines. But what we are wary about is anaphylaxis, and this is the severe allergic reaction that presents with two or more of the following symptoms. and usually occurs in the first 30 minutes after injection, but very rarely can happen within the first 1 to 4 hours and must be managed with epinephrine. So, just to give you an idea about how many patients may have anaphylaxis, so Moderna and Pfizer, based on their clinical trials, already documented some patients who developed anaphylaxis to these particular vaccines. So the World Allergy Organization Anaphylaxis Committee has been monitoring these clinical trials and looked at the rate of how many patients develop this vaccine associated anaphylaxis to the COVID 19 vaccines. And here you see, these are based on clinical trials again. You could see that for the Sinovac and the Sinopharm vaccines, no anaphylactic events have been reported. But in the real world, in vaccine effectiveness studies, we have seen some patients, but very rare. Now, for the mRNA vaccine, they actually contain this component called polyethylene glycol, which is known as the allergenic component of this mRNA vaccine to distinguish it from aluminum hydroxide, that is the antigenic component or the allergic, possibly allergenic component in Sinovac vaccine. But for the mRNA vaccines in their clinical trials, they did not see any anaphylactic events, but in real world, they did see. And to be honest, I have seen some patients who have had immune or anaphylactic reactions to both Moderna and Pfizer vaccines here in the Philippines. Now, what about the viral vector vaccines like Astra and Gamaleya vaccines? No, these, on the other hand, contain polysorbate 80, which is the antigenic portion. And in their studies, they have not seen also any anaphylactic event. But in the real world, we have seen patients referred to us for allergies to either of this vaccine. So it's just telling us that in the clinical trials, there were really no reported anaphylactic or severe allergic cases. But in real world, we have experienced anaphylaxis to all, as allergists, we have seen anaphylaxis to all the different vaccines here in the Philippines. And they are not common. They are very rare. So this table actually was set up by our COVID 19 vaccine task force group, headed by Dr. Maricar Ang, to sort of risk stratify patients who may be low risk, moderate risk, or high risk to the first dose of COVID 19 vaccine. So take note, you are considered low risk, meaning you can proceed with vaccination and observation if you've had a non anaphylactic type allergy to oral medications or a non-anaphylactic allergy to foods, pet, insect venom, environmental allergens, or latex, if you've had delayed local reactions to other vaccines, if you've had reactogenic reactions to other vaccines, if you have well-controlled allergies, if you have primary or secondary immune deficiency, but this must be evaluated well by an expert that's taking care of you, as well as for autoimmune disease, and if you have a family history of allergy. Now, you become moderate risk, meaning there may be some precautions to vaccination, and you have to be referred to a qualified specialist for evaluation and monitoring if you've had anaphylaxis in the past to other oral medications, food, latex, insect venom, or an unknown etiology. If your asthma is uncontrolled or your allergies are uncontrolled, it is best to see your doctor to control it first before receiving vaccination. And if you have had an immediate, within 6 hours after exposure, allergic reaction of any severity to an unrecalled vaccine in the past or other vaccines with components that are not found in the COVID 19 vaccine. And here I've mentioned the only contraindication to the first dose is if you have had an allergic reaction of any severity to a component of the COVID 19 vaccine, whether it be the polyethylene glycol in mRNA or polysorbate in the viral vector vaccines or aluminum hydroxide in coronavac because some of these vaccine components are present in the other regular vaccines that we receive even in childhood. So here again are those who can receive the COVID-19 vaccine. So those who have allergy to food, even eggs, allergy to inhalants, venom, who have atopic dermatitis, asthma, rhinitis, urticaria, or history of rash to oral meds, you can receive the COVID-19 vaccine. It is not a problem. Patients with depressed immune systems or autoimmunity, we still don't have very good information, but we have to assess this if their immune system can sort of respond to the vaccine properly, and it will be a shared decision making between these patients and their doctor as to whether they want or can receive the vaccine. Okay, again, I'm reiterating those who should not receive the COVID-19 vaccine for the first dose are those with immediate reactions to the first dose or a history of allergy to any component of the COVID-19 vaccine. And if you are within this group, then you have to see an allergist for further evaluation. If you do not know any allergies, I think Maxicare has a list of allergies, but you may also go on our website at www.psaai.org. Now, what about those who've had a reaction to the first dose and you are scared to receive the second dose? Again, we also did our risk stratifications. So on the left side, all of these scenarios, if you've had no reactions, if you had a local reaction only, if you had the fever, the chills, the swelling, or you've had a vasovagal reaction, this is actually a fainting reaction because you were scared, no? Then you may proceed with the second dose without a problem. Now, those that have the other symptoms, like delayed reactions after the first dose, like delayed skin rashes, meaning more than 24 or 48 hours after, the presence of thrombosis or thrombocytopenia, then you need to be seen by a specialist before you have to receive the second dose. If you had an immediate mild reaction within the first 6 doses after the vaccine that is non-life threatening, maybe like a rash or flushing without urticaria or hives or just tingling, then maybe the doctor has to review your history, or the specialist like the allergist can review your history and give you clearance before you receive the second dose. Now, if you've had an immediate moderate non-anaphylactic reaction within the first dose, meaning you have the swelling of the eyes, maybe hives, but your throat, your breathing is clear, then again, we have to reassess you. But the only ones who cannot receive the second dose of the COVID-19 vaccine are those that developed a severe anaphylactic reaction in the first hours after their first dose, and they really cannot receive the second dose. Okay, so these patients that may need to be reassessed by the allergist and possibly given another vaccine platform for their future doses. So we have to reiterate that decision to give the second dose should be individualized, since it's not feasible to describe all possible scenarios, and data on the different vaccines are still evolving. So a shared decision making between the physician and the patient regarding benefits and risks of receiving the second dose is advised. And all patients should be observed for at least 30 minutes after vaccination in a setting fully equipped to manage anaphylaxis. So if anaphylaxis should happen, and many are scared to have the vaccines, thinking that there's no epinephrine in our vaccination centers. Yes, our local government and vaccination centers have been primed or have been taught to always have epinephrine on standby if you develop a reaction. Our society also has provided this algorithm for the healthcare workers who will be giving the vaccine, so that they will be addressed uh, correctly. So in summary, reactions to COVID-19 vaccines may happen, but majority are local or systemic side effects that will disappear within 1 to 3 days. Mild allergic reactions are managed with antihistamines. Anaphylaxis, or the severe allergic reaction, is rare and is managed with epinephrine. Patients with allergies to food, inhalants, insects, and those with stable allergies can receive COVID-19 vaccine. Patients who should not be vaccinated are those who've had an allergic reaction to the first dose of the COVID 19 vaccine and their components, such as aluminum hydroxide, polyethylene glycol, or polysorbate. Patients who have an allergic reaction to other vaccines and injectable meds should be referred first to an allergist for further evaluation if they can receive a vaccine. Patients should always be monitored for at least 30 minutes. These are allergic patients after vaccinations. And finally, I think the most important statement we'd like to give is that based on current data, the benefits of receiving COVID-19 vaccine far outweighs the risk of an allergic reaction. Just see that your Pfizer mRNA vaccine has reported 5 allergic reactions. These are anaphylactic reactions in a million people. But there's 100 times more likely chance for us to die from COVID-19 rather than have a serious allergic reaction to the vaccine. So I want you to think about that. Furthermore, the vaccine allergic reactions, we have ways by which we control that, but for COVID, there is no cure. So we are concluding this lecture with this statement that the best vaccine that can be offered is the one that is immediately available to you. So I hope with that we have answered some of your concerns and questions, and the time is now open for our Q&A. Thank you very much for your attention.
Thank you so much, Dr. Recto. You know, we really did learn a lot, and that presentation was absolutely thorough. And I know that because of what you presented, people are eager to share their questions, and we're going to get to that in just a short while. I'm sure all of you Maxicare members learned so much about the vaccines and what happens to our body after we get our first or even full doses. Ako rin, ang dami kong questions because I also had some personal struggles, but I'm going to leave it to your questions first. Kaya this is the time that you can continue to send your questions on our Q&A box. So we will be getting our facilitator on board in just a short while. Let me quickly introduce her and get this going. She is a consultant at Makati Medical Center and UniHealth Parañaque. She was also a diplomat in the Philippine Society of Allergy, Asthma, and Immunology. I'm so glad that we have her on board to go through all the questions that you've sent. Please let us welcome Dr. Caroline C. Aquino.
Hello, good afternoon, everyone. Thank you, Dr. Recto, for that informative lecture. So I learned a lot also. So anyway, just a very short recap. So Dr. Recto taught us the different types of COVID vaccine that we have and being studied and available here in our country. She also discussed the different adverse effects, the difference between a reactogenic and an allergic reaction, and that remember that allergy to the vaccine is actually very rare and that the only contraindication is if you have a severe allergic reaction after the first dose. And remember that the benefit of receiving outweighs the risk, no? So, okay, so we have a lot of questions ready. Are you ready, Dr. Recto?
Sure, Carl, let's go.
Okay, sige po. So for the first question, so the patient is asking, the Sinovac is already completed. Can they get a booster, specifically Moderna?
Okay, this is a hot topic, no? We keep on getting these questions
Yes.
from our patients. And the answer to that is we do not know yet about combining Sinovac with the mRNA vaccines. But we have heard about combinations of AstraZeneca with Pfizer vaccines that it really produced an immunogenic or a better immune response. But unfortunately for Sinovac, it's still a question mark. But you know, Carl, theoretically, it could be, no? It's just that we don't have the data now. And our society in PSAAI is embarking with us in a study with DOST to find that out, mixing and matching Sinovac with different permutations of COVID-19 vaccines as a second dose or as a booster. So I think I cannot really categorically say it can be done, but we will wait for the data.
All right, so that's something to look forward to, no? So we have a lot of studies regarding the COVID vaccine coming. So up next is the mix and match. Okay, so the answer is we just have to wait. Okay, next. The patient had COVID already about a month ago. So can the patient get a COVID vaccine in a health center, considering he has hypertension and diabetes?
Okay, so you are a high risk patient because you have comorbid diseases. As long as you are already COVID asymptomatic and you have finished your quarantine period or your isolation period of, I think it's 14 days, no? You may have your COVID vaccine. So it doesn't matter what kind of COVID vaccine you receive, and especially that you've had COVID and you are comorbid, I think you should have the vaccine.
Okay, so for our next question, the patient had the second dose of HPV vaccine last June 26. Now, what is the earliest time that the patient can have the first dose of COVID vaccine?
Right now, the recommendations are there's no problem that having any vaccination done after COVID vaccine. But personally, when I have patients like this, I give it around a week interval just to make sure that whatever reactions will not be attributed to either vaccine. So it's just a matter of being prudent to space it out. But if you really are nagmamadali, no, sometimes you can have it naman. There's no contraindication to or any time frame between vaccines that are not recommended.
Okay, so currently there are no more, there's no need for any time frame. Kaya lang I think the problem now is that the LGUs, they have their own guidelines, I think That's what I hear. But
Yeah.
yun nga po, at least a week just to make sure that there are no adverse reactions in between. Okay, the next question, do we have any idea when the vaccine for kids will be available and anong brand if ever? And also, will there be special considerations for children with autoimmune disease?
Okay. Baka makalimutan ko yung mga questions. Okay, so first is it available for children? We
For
do
the
not have
kids, apo.
yet available, but there is an emergency use authority permit already granted for Pfizer. So Pfizer vaccine has applied for EUA for 12 to 17 years old, no? And it has been approved in the Philippines. Unfortunately, because we lack vaccinations for our target population, these are the adults, the elderly, and those who have comorbid disease, and even the workers, essential workers, the children are not in that priority list. So we have to vaccinate the other patients first, even though there's Pfizer, that is coming to us. Now, the other vaccines have not yet really applied for EUA. I think Sinovac is applying. So we don't have yet any news about that. Now, about having autoimmunity in children and vaccinations, again, there are no studies on that. So even for adults, autoimmune diseases, they say, are not going to be a contraindication to vaccinate. But in the clinical trials, they did not really test on patients with autoimmunity or immunodeficiency if it is effective or not. So marami pang questions in the air.
All right. Okay. So currently the priority are still the adults, no? Yung mga nasa special groups. So another question, Doctora, is the vaccine that comes in our country, in the Philippines, are valid to protect us for how long?
Okay. The clinical trials are not yet over. They started last year, and the clinical trials for all these vaccines will finish in 2022. Okay, possibly 2023 for some. So we cannot give that data until the companies have finished their clinical trials. No? So we do not really know the answer. Okay, so we just have to wait for the published clinical trials.
Okay, so we have to wait until when the vaccines are effective and if we can mix and match. Okay.
Yeah,
Sige,
marami pang
Doctor.
hintayin.
Yeah, marami pa nga po studies. Okay, another question, Doctor. Which vaccine is the most effective for the Indian variant? What
This
do you
is the
think?
Delta variant. No?
Yeah,
Oo,
the
mahirap
Delta
talaga
variant.
mag-commit dyan.
Yeah, yeah,
I don't know, Carl, if you've been reading all these different videos, one vaccine
yeah.
claiming to be better than the other.
Yes.
And
Mm.
honestly, there are no head-on trials, there are no head-to-head trials that have seen that there is a certain vaccine that stands out. No, many of our countrymen, no, are kind of biased towards the mRNA vaccines because they
Mm-mm.
are heavily marketed abroad. People seem to be maskless there, etc. But the Delta
Yeah.
variant has not penetrated there yet, so we do not even know, no, if that their protection with the mRNA is actually very effective, no. Um, I cannot, people always ask if you were to choose the best vaccine. For me, actually, they are all kind of equal in the sense that they protect against severe disease well, but efficacy wise, they may range, and we do not know which has the best profile, especially for the variants. Because when they made the clinical trials, wala pang mga Delta variant. So
Yeah.
yung mga vaccine efficacy rate, about 95%, 94%, that was based on the Alpha variant. So Delta variant, I know it went down. So mRNA vaccines from 95% became 66%. Okay?
Okay.
So you see that we still are trying to have a race against COVID-19. We have not
Yes.
come up with the magic vaccine yet.
All right. Okay. Then another question. Okay, since these vaccines, you mentioned, Doctor, they're still on clinical trials, right? Is there a placebo being administered?
In the clinical trials, yes. It is there. All these trials are randomized controlled trials, no, meaning that there's a group that was given the vaccine with the viral component, and there's a group that was just given the liquid, okay, either aluminum hydroxide, polyethylene glycol, and they were compared. But all the studies have eventually given the vaccine to those patients who were given the placebo later on. Because the study has, that's unethical. So they really would have to give these patients who were not given the COVID vaccine the vaccine eventually. No, so they
Yes.
will be given. But for now, unfortunately, under trial sila, and they signed for that.
Yes. Okay, Doctor. Okay, another question. Can we get vaccinated if you're currently under medication? Like, for example, her case is PCOS, polycystic ovarian.
Yes, there is no medication with the exception, I guess, of high dose immunosuppressants, no? Like high dose steroid,
Steroids.
high dose chemo, the one that
Yeah.
will suppress the immune system. That one we do not really advise, no, diba, to give vaccination, any kind of vaccine, because it will not cause the immune system to work well. So you might not produce a good vaccine, no? But the others, yung
Antibody.
maintenance medications, even anti-allergy medicines like
Yes.
antihistamine, there's no problem to take them if you have vaccination.
Okay. So I think is this going to be our last question na po kasi we're about to ano. Okay, one more. Is there a rule or law that you will not that you're not allowed siguro to take your booster with a different brand? I'm not sure kung yung question na is after instead of getting this brand, yung second brand mo iba. So parang it's related to the mix and match.
Yes. So many people feel insecure, no? With, let's say, lalo pa yung those who receive Sinovac, they feel they
Yeah.
got the shorter end of the stick, no? And that they should receive a booster because that is what's being done in other countries, no? We have to see that the clinical context or the cultural context is actually different, okay? The scenarios are actually different. Here we are actually lacking vaccines. That's why the talk about a booster is not there, because we have to
Yeah.
vaccinate everyone first before we can boost, because that will take out the allocation from somebody who needs it, no, if we do the boosters. So there's no law that will stop you from having a booster. Maybe the chance, if you really want to have your booster, is if these vaccines will be sold commercially and you can have the liberty to buy your own vaccine. But as of now, all vaccines are donated. So that's why we
Yeah.
cannot insist on the third shot. No? Some people I know have bypassed the system. They have tried to get another course of another vaccine.
Yes.
But I hope
Mm-mm.
makonsensya naman sila, no? Na there are people out there who are really scrambling to get the
Waiting.
vaccine, and you are getting your second set of vaccines. Parang I think our conscience should, you know, be open to that, no? Nakakahiya naman, nakakaawa rin.
Yeah, okay. So let us share the vaccine to others. Kasi maraming ganun, Doctor. They're waiting for their private vaccinations parang as booster. Okay, one last question, Doctora. I am breastfeeding. Can I get my COVID vaccine?
Definitely, breastfeed vaccination of COVID-19 should not stop your breastfeeding. Okay? And even if you're pregnant, you can get the COVID-19 vaccine as long as you're not in the first trimester. So even patients with COVID I can breastfeed, di ba? The mother just has to cover their mouth or their nose while breastfeeding.
All right. Okay. So I guess that's the questions for this afternoon. Thank you so much, Dr. Recto. We have learned a lot. I'm sure parang marami pa kanina sa Q&A, pero we only have a limited time. So to sum up, let's all have our COVID vaccine because really it is a race against the disease, and that the only contraindicated talaga is if you have a severe allergic reactions and severe anaphylaxis after the first dose. And when in doubt, seek an allergist.
Thank you so much,
Yeah.
Dr. Aquino. Before we
Thank
let
you.
Dr. Recto go, Dr. Recto, your final message for all of our Maxicare members in attendance.
Okay, so I hope with this lecture, you have been apprised about the status of the vaccine efficacies and effectiveness issues, and also about possible allergic reactions. We shouldn't be scared about vaccination because this is the only way we can achieve what we call herd immunity. And herd immunity is not only for our house, no, it's global, so that we can try to get back to where we were before. This is the only way to go. And if we don't work together, we will not be able to achieve that, and we will always be stuck in this scenario, maybe for a long, long time. So I hope you have all been your questions, most have been answered, and I hope that you will really all get vaccinated soon. Thank you.
Thank you so much, Dr. Recto. Hope to see you again and maybe join more of your lectures. It was very informative. We appreciate your time. Thank you to Dr. Marisha Stella Recto and, of course, Dr. Caroline. Before we let you go as well, Dr. Caroline, you saw all the questions and you can really feel the heart of the people here from Maxicare, and you can get a sense of where this is leading. Do you have any more words of encouragement for everyone in your final message?
Well, I think just what Dr. Recto said, we just have to get the vaccine so that everyone's protected. By getting the vaccine, you're not only protecting yourself, you're also protecting the people around you.
Thank you so much, Dr. Caroline Aquino. We really appreciate it. That was really such a valuable experience for all of our Maxicare members tonight. To our attendees, thank you so much for participating in the Q&A and for being so engaged all throughout. Our Maxicare members, may we please invite you to take a few moments after this to answer a feedback form. Here is the link on the chat box, and also this is a QR code that we're sharing with all of you on the screen. You can take a copy, get a copy of that QR code or the link itself, but your feedback truly will be appreciated. So please do take the time to answer that. Now we will announce the winners of our raffle, which is also very exciting. The winners were randomly selected by our staff. And just a reminder, we are giving away a laptop bag, a foldable umbrella, or a mini clutch bag. And these are really important and very useful nowadays. So the Maxicare team will get in touch with those winners who will be announcing right now. Congratulations to the following. Wow, look at your names there. We have Jennifer Makam from Filmico. We appreciate you being here. Congratulations. You get that laptop bag. Nikki Ann Ramirez from Standard Insurance. And then Nathaniel James Luyong, also of Lexmark. Congratulations, and thank you so much for being here and staying all the way to the end, because we know anyway that this topic was really so useful and so important to all of you. So we appreciate you. But before you go, can you just quickly answer last two? We have two more poll questions that we want to ask of you. And the first one always is, and this is something that we all have to practice, we have to ask ourselves these questions so that we can be affirmed. Do you want to live your best life? Remember, if you were there with us during Brother Bo's event a couple of weeks back, he said, you really need to affirm yourself and everything. So this is one way. So tell us, do you want to live your best life? And the answer is a resounding yes, of course. May natitira din na oo, syempre, but that's all the same. We all want to do that. That's why we keep coming back and we keep appreciating all of these Maxicare events. And speaking of which, we do have some options. We want to know which ones would you like to see in our next Wellness Fridays. You can actually opt to choose, and you can choose more than one, by the way: diabetes, diagnosis, treatment, and management of it, nutrition in the digital world, how to be a productive work from home employee, or PICOS, symptoms, causes, and treatment. All of this are very good. Very good topics, and I know hopefully we'll be able to experience all these wonderful events. Let's see the results on what is most significant to you. A lot of people really want how to be a productive work from home employee talk, and also nutrition in the digital world. Thanks so much for sharing your thoughts with all of us. You know, if you enjoyed this experience, which I'm sure you did, please do share it on your social media and use the hashtags Live Your Best Life and Maxicare Wellness Fridays. And you can also tag Maxicare as you do that. Please do tag them on Facebook at Maxicare Healthcare Corp, their official IG at Maxicare Healthcare, and the wonderful men and women behind the Maxicare Wellness team have put together an IG account as well, and that's at Maxicare Health and Wellness. Tag them when you're sharing about your wonderful experiences and what you took away from this event. Don't forget to also subscribe to their YouTube channel, because I saw in the chat a lot of people are asking for the videos of the talks. Please do go to Maxicare Healthcare Corporation's YouTube channel. To learn more about Maxicare's products, please do visit www.shop.maxicare.com.ph. Share that URL with other people so they too can be members of this wonderful community, and of course get to have Maxicare products. If you have questions about Maxicare's Wellness Fridays, you may even send an email at maxicarewebinar@maxicare.com.ph. So I have an announcement. We'll see you guys on our next Maxicare Wellness Fridays, which will be on July 23 at 5 p.m. as we have a talk about nutrition in the digital world. Tingnan mo, ang bilis ng reaction ng Maxicare. But we all know we need to eat better, right? In this digital world, that makes it even more interesting for me. And this will be given by registered nutritionist, dietitian, Joe Sebastian. She is wonderful. The QR code for the registration will be flashed on your screens right now, so make sure you register early. This is, again, something that we all need to hear. But this right now ends our event for tonight. Thank you so much for being with us. We hope that you enjoyed and you were able to take away a lot of meaningful information. Thanks again, and have a great evening. We know that with Maxicare, you can all live your best life.